Is insurance your friend or foe? I want to give you a behind the scenes look at what practitioners and healthcare practices go through to try to work with insurance. And I also want to let you know why it actually may not be your friend and actually may be something that's hurting your health more than it's helping it. Hello, my name is Dr. Brandon Buck. I'm the owner at Advanced Health and Wellness Center, and we specialize in corrective, really helping to rejuvenate health and improve the quality of life for our patients. Not disease treatment, not symptom management, but actually trying to maximize and improve our health to our greatest well-being in order for us to really express the greatest version of ourselves. We need to have great health. Insurance does not help you do that, unfortunately. I want to go through a few things with you guys today. I think this can be educational for some of you that may or may not understand exactly how insurance works and what providers are going through when they're trying to use insurance to your benefit. The first thing to understand is that it can be very limiting in what services you're actually able to do. Doctors are always very frustrated by the fact that they're not actually able to recommend the things that they really want to recommend because of one word. I don't know if you know what that word is. Anybody? Medical necessity. So insurance companies come up with their own medical necessity guidelines. So that's the first kind of thing that I wanted to talk about. So medical necessity means, what does the person qualify for this treatment under insurance guidelines? And insurance companies have their own guidelines. Many of those follow Medicare as the primary governing agency. Other insurance companies can have their own rules and regulations, but lots of times Medicare is the standard by which other insurance companies will set their policies. Medical necessity is if these requirements or these qualifications have been met, then the person could do or utilize whatever service they would qualify for. So, for example, if we're talking about knee problems, if a patient comes into our office and they have knee pain, we would examine them, do an x-ray. If Leah finds that they need to have, she's recommending them to do like the hyaluronic acid injections. Now, there's about 5 or 6 different brands of hyaluronic acid injections, and there's also a set of medical necessity guidelines. If the patient doesn't meet those medical necessity guidelines, she can't start with the thing that she'd like to start with. What actually ends up happening is the person has to have failed treatments prior to getting to do the thing that she wants them to be able to do, which doesn't make any sense, hopefully, to you guys. So she would have to say, well, you need a cortisone injection or an anti-inflammatory injection. Most of the time, the whole reason why somebody's doing hyaluronic or the gel injections in the knees is because they don't want to do cortisone or anti-inflammatories because they know that those things are not good and have more side effects. The gel is more natural, helps to lubricate the joint, actually improves function. So what you have to do is fail some type of medical treatment before you can actually get a couple different types of treatment, before you can get the thing that she lacked to give you in the first place. Some other examples with different types of joint injections, trigger point injections. We used to be able to do multiple trigger point injections in a short period of time, which would like pretty quickly reduce the spasm or the irritation in the muscle. Now the regulations are you can only do 2 and they have to be a week apart, and then you can't do another one for another 6 weeks. And that just doesn't equate well to, again, what is best served by the patient. So there's these medical necessity guidelines, and then there's pre-authorization. Many of you guys have heard of this pre-authorization. So that means we do an examination. Before we can do any treatment, we have to send it to the insurance company so that it can be pre-authorized and they can decide whether they're going to pay for it or not. So again, that patient has to meet a set of guidelines set up by the insurance company, not by the provider, in order to determine whether they can do that service or not. Many times when we're trying to do pre-authorizations, again, going back to the hyaluronic acid injections, the insurance company is actually choosing which injections the provider can use. Some might cover Synvisc, some might cover something else. Some others may cover Orthovisc, or there's Suparts, or there's a list of several different options. I don't know exactly how many, 5, 6, maybe more than that. But it's not the medical provider's choice, it's the insurance company's choice. And that is wrong, guys. That is absolutely wrong. Same thing with blood work. So vitamin D, we know that patients should have their vitamin D checked. Well, you have to meet a certain set of criteria in order for that to get covered or paid for. And many times it's not medically necessary. And the reason I was told by an insurance representative, because everybody has low vitamin D. So it's not necessary to test, which again, doesn't make any sense, because if it's low, we want to know how low it is so that we can get it up, and how much vitamin D supplement we would want to do. And then we retest it to find out if it actually works or not. That's what happens when we leave those decisions up to the insurance company. They talk to providers. Their guidelines are set up that we do the cheapest or the least expensive thing first, maybe not the best. And if that works, then you're done and we don't move on from there, which is not always providing the best care to the patient. But if you want them to pay for it, you have to play by their rules. So that's pre-authorization. So it has to be reviewed by somebody that's never seen the patient before, just reading the documentation and making a decision on whether they can get said service or not. Then there's medical guidelines. So Medicare or other insurance guidelines. And like this one statutorily says a treatment plan. This is section Medicare guidelines, section 2251.3 says a treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or therapy that is performed to maintain or prevent deterioration of a chronic condition, is deemed not medically necessary. I don't know why. That doesn't make any sense to me, because you would think that if somebody were trying to do something to enhance their quality of life or promote health or prevent deterioration of a chronic condition, that would actually save the insurance company money, because they would need less treatment in the future. But that's not covered. So patients always ask us in our office, hey, my insurance company says I get 12 visits a year. That is not true. You may get 12 visits a year, but you have to use them in a treatment plan for an acute condition, not for maintenance or wellness. That is a Medicare guideline. You can look that up. 2251.3. Guys, that's all unfortunate. But when someone else is paying for your bill and their job is to make as much money for their shareholders as they possibly can, to be as profitable as possible. I don't know if you guys have ever read this. Go and research bonuses paid out to health insurance CEOs. Their bonuses are paid out based on money that is the profit for the year. How do you make more profit for the year? You raise rates and reduce spending. So reduce coverage. And so we have to be very, very careful about letting insurance dictate the type of healthcare we want. So I hope this was informational. Guys, we have a YouTube channel. Please subscribe to it. We're going to continue to post, hopefully, educational, awesome content. If you like this, give us a thumbs up, like it, hit the heart button, share this to your friends and family. Many people need to know what's going on so that we can make the best decisions for our health as we possibly can. If you have health concerns or questions, please let us know. We have insurance verification experts here in our practice that can help and get you, specific information about how your insurance would be covering services in our practice, the steps that we have to go through. We call that a free insurance verification, and that is free for every new patient, every initial consultation and evaluation. Again, remember, that's free. It's just an educational chance for us to have an educational conversation, find out what's going on, and see if we can help. That's it for today. Hope to see you soon.